Today we are focused on advanced directives and end-of-life documents, a critical area for the NCLEX. The exam will test your ability to act as a patient advocate while navigating complex legal and ethical scenarios. Let's break this down. First, you must distinguish between the types of documents. A living will is a legal document outlining a person's wishes for medical treatments if they are no longer able to communicate. It typically addresses things like mechanical ventilation or tube feeding. In contrast, a durable power of attorney for healthcare, or a healthcare proxy, is a document where the patient designates a specific person to make healthcare decisions for them once they are deemed incapacitated. The key exam point here is that the proxy can only make decisions when the patient cannot. If the patient is alert and oriented, they make their own decisions, regardless of what the proxy wants. A less common but vital document is the physician orders for life-sustaining treatment, or POLST form. Unlike a living will, a POLST is an actual medical order. It is printed on brightly colored paper and travels with the patient across different care settings. For the NCLEX, you must recognize that a POLST provides immediately actionable medical orders for emergency personnel and other providers, covering things like resuscitation, intubation, and feeding tubes. Now let's consider a classic NCLEX scenario. You are caring for a 78-year-old patient with end-stage COPD who has a valid Do Not Resuscitate or DNR order documented in their chart. The patient suddenly develops severe dyspnea and their oxygen saturation drops. The patient's daughter, who is at the bedside, panics and screams at you to do everything. What is your priority action? The exam is testing your legal and ethical responsibility. Your priority is to uphold the patient's wishes as documented in the valid DNR order. This means you will not initiate CPR if they go into cardiac arrest. However, a common exam trap is to think a DNR means do not treat. This is incorrect. You would still provide comfort measures, such as administering oxygen, positioning the patient for easier breathing, and providing pain medication as ordered. Your actions must align with providing compassionate, non-resuscitative care while also calmly explaining the care goals to the distressed family. Another trap is confusing a DNR or DNI (Do Not Intubate) order with withholding other appropriate medical treatments. A patient with a DNR order still receives antibiotics, nutrition, wound care, and other necessary medical interventions. The order is specific to cardiopulmonary resuscitation only. To remember your role, use the mnemonic ADAPT. First, you ask. Upon admission, ask if the patient has an advance directive. Second, you document. Ensure the document is in the medical record and its status is clearly communicated. Third, you advocate. This is your primary role, ensuring the patient's documented wishes are respected by the entire healthcare team, even when faced with conflict. Fourth, you provide. Provide care that is consistent with the patient's directives, whether that is full treatment or comfort-focused care. Finally, you teach. Educate the patient and family on what these documents mean and the plan of care. By following these principles, you can confidently answer NCLEX questions on this topic.